Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
The topic today in Neighborhood Health Watch is COPD and congestive heart failure. The late former First Lady Barbara Bush had both of these diseases and decided to focus on comfort care instead of seeking additional medical treatment. She died yesterday. Both diseases can cause shortness of breath when a person is doing something physical like exercising, climbing stairs, or walking for a long distance. Breathing problems happen for different reasons with these conditions. Erin White, an adult nurse practitioner with Henrico Doctors Hospital, is here to get us informed. Thanks for joining us for First at 4. We appreciate it.
Thank you for having me.
Barbara Bush smoked for many years, but she quit in 1968. Is smoking one of the primary causes for both of these diseases?
Yes. Smoking is one of the risk factors for chronic obstructive pulmonary disease, or COPD, as well as congestive heart failure.
And what's the difference between the two?
So congestive heart failure is when the heart muscle becomes weak and is not as efficient as at pumping blood forward to the body and the organs of the body. Chronic obstructive pulmonary disease is when there is air trapping, and when you exhale, you're not able to exhale the breath you took in.
Talk about how these two diseases attack a person's body and what's going on inside.
So with COPD, you can have decreased oxygen to the body that can put more strain on the heart. And with decreased oxygen to the heart, it can make the heart muscle weak. And with CHF, congestive heart failure, you can have fluid push back into the lungs, and as fluid builds up in the lungs, it can become harder to breathe. Pressure from the lungs with COPD can put pressure on the heart as well.
How can a person lower their risk?
Not smoking, maintaining healthy weight, exercising, getting screened or treating high blood pressure, taking their medications as prescribed, and following up with their doctors routinely.
And how long can a person live with congestive heart failure?
Congestive heart failure can shorten someone's life. Usually,
how does the treatment work in terms of it?
So
what do you do?
Usually it is diuretics to help try to reduce fluid buildup, also try to help control blood pressure to decrease the strain or the workload on the heart. And that can help with longevity. There are also pacemakers or devices that can try to help increase the stimulation or the contraction of the heart.
How easy is it to make a diagnosis?
You can do an echocardiogram. You can also do a left heart cath, which the physicians that I work with can do to try to understand if someone has a weakened heart muscle, and then pulmonology, or we can do lung function tests, x-rays, things like that to work up for COPD as well.
All right, Erin White, thank you so much. We are informed. We appreciate you